come on and tell you thank you so, so much. I went today and I passed the boards.
Wow. Wow, I'm sure you feel relieved.
Yes, I am. I just want to reach out to everyone who's here to tell them thank you and tell them that they have to just follow whatever you tell them to do. Guys, let me tell you, everything that Dr. Lopez says or teach on the crash course and on the PDF, everything was there. Susco, the clock drawing, everything was there. Parietal, the thalamus, everything. Guys, please listen to Dr. Lopez.
I
It
appreciate
was,
that.
I went through it and I told you, I went through it and I was wondering to myself, wow, why is this so easy?
Lisa, it's not easy. It's actually pretty hard.
It is hard,
But
but
the
I'm
way
telling
you
you,
prepared is what made it seem so easy. We had someone else yesterday that took the board first time and failed, and then she took it again yesterday and she passed, and she said, "Oh my God, this cannot be the same test." I promise you, there was the same content, that probably the same test. I don't know, I wasn't there, but your perception of it is totally different this time because you worked hard. I
yes,
looked at your account. You had completed like 100% of everything.
yes. Because remember,
Ye- Yep.
yeah, because remember, Dr. Lopez, I went this on January the 15th and I missed it by a point.
And then you ghosted. You like kind of went into depression and you came back.
And I came back. I was studying. I
I
was
know, I
studying.
know.
And I said,
I,
like, I'm not going until I'm 100% I'm ready.
yeah. I mean, I wish that no one has to go through your experience at first to realize what is, what you have in front of you. Because a lot of us will need to do that. We need to
Yes.
fail first to realize what you are up against. Because some people think they can just brush it off, and some people
No.
can.
Mm-mm.
But I'm telling
Mm-mm.
you, it's your life. It's the most important test of your life. And our job in general, right, is kind of like not fall for things that we know is going to hurt us. If you know this is going to hurt you, please get on it early. I mean, there is no other way about it. There is no
No.
magic.
You're right.
You have to put the work.
Yes. And I thank you, Dr. Lopez. If it wasn't for you, this would not be possible. And I thank God. And I thank
Amen.
the WhatsApp family for, it was just amazing.
Amazing. Huh?
I just
It,
want to let you know I want to join the pharmacology class with you and do everything that I have to do with you.
Amen. Amen. It's just the beginning. I think you are over the biggest hump and the most difficult hump. Everything else from now on is just getting a little bit more clinical experience, learning, still making mistakes because that's normal. We all do. But this is the biggest challenge of all. After 2 years or 3 years in school, how to put that together in 175 questions, right? And what is important and what is not important, because we got to take all the noise out and focus on what is important. And that
Yes.
alone is a lot of content.
Yes, yes, yes. And I had registered for both. I registered for the other one, which is the next 2 weeks. So I'll see how that goes.
Oh, you will pass. You just have to stay on it. Don't lose momentum. But you will definitely pass too. Usually
Thank
when
you.
someone passes one, they pass the other. If
Thank
and if
you.
they failed one, they will fail the other. So it's
Right.
not really the test, it's your preparation, guys. I don't know how else to say
Yes.
this.
Guys, you have to prepare. You have to print that PDF. You have to listen to everything. Go over your stuff, guys. Go everything that Dr. Lopez was talking about in the crash course. I have not missed a crash course. I have not missed any of his classes. I mean, I missed the Kahoots on Thursday because I work Thursday nights to Saturday. But everything, guys, everything. Please listen to Dr. Lopez. I
Yeah.
will be filling out your everything that you need from me on the I'm gonna give you five. If I could give you 10 stars, Dr. Lopez, I would.
Amen. Thank you. Appreciate it. I know you worked really hard, so I could not be happier. Uh, when I did like a little bit analysis of your courses, like you did everything, every
Thank
single
you.
thing. You downloaded everything. I see that you watched it. You completed 100% of your course. You're definitely prepared. No wonder it felt easy because you were
Yes, it
there.
did. I couldn't
So,
believe it.
yep. Well, that's super happy. That is what we, strive for. And I don't know if other people do this, but we let you come in for 3, 4, 5 crash course reviews, and we don't even charge you for that.
No,
So,
and that is one of the thing I have to take my hat off to you, Dr. Lopez. I remember sending you, I was at work and I was doing on my iPad, I was doing the Q bank. And one of the time I was locked out and I sent you an email and you said, don't worry, I got you. Here you are. I reopen it. Let me tell you, this man is a God bless man.
no, thank you for your kindness. I really appreciate it. Really, really appreciate it. It really, um, everyone should have this feeling of passing. This is not a joke. This is not an easy task. And if you take it lightly, uh, you will find some difficulties, right? Even though she passed, I told you a story of someone that took the diagnostic test 40 times, right? That is
Mm-hmm.
such a waste of time because you're putting all your focus on the diagnostic test as if it's going to be the same. It's not going to be the same. You have to apply critical skills. And
Yes.
unfortunately, today we had someone too that had taken the diagnostic test 5 times each, so that's 20 times. Yet, didn't complete the crash course review question bank. Yet, didn't focus on the other things. So I don't know how else to tell you guys that even though the diagnostic test is super high yield, I agree, it should not be skipped, but
No.
it's not one component what makes you a pass. It's the whole thing. So today, I want to make sure that everybody knows that the crash course review is not the same one as the 600. This is a premium content that I give it to you that it is in a full course or you are enrolled in a crash course review. It would not be fair. It's already unfair because I give the diagnostic test, but you paid for something. It is for you to have it. I can't be giving away something that costs you money, so it's not fair to you. But please, at today's event, make sure everybody knows that we have a crash course review question bank. It is not the same as the 600 question, and you must do it. Okay, I even write it out as much as possible. Must complete crash course review questions.
Yes, must. Because a lot of them was up on there. Yes, indeed.
And I'm telling you, if you completed this, you should be getting about 40 to 60 questions in your test. It's not going to be the same, but only questions that are very, very selective comes here. Everything else is kind of like the basic, right? We got to understand foundation, scientific skills, all that. And then I put more for you to practice if you want to. But
Please,
this is the basic.
for the
Now, this is a
600,
must. You have
is-
to do this.
Dr. Lopez, how do you get to this again, please?
I sent you an email, Joseph, today.
Okay.
Hi,
Okay.
Dr.
So
Lopez.
I think I explained it, the crash course review. If I left that out, I think I explained to you and I included the documents for the crash course review. If I did not, email me back, okay?
And the 600 questions are in the crash course review?
No, those 600 questions are only released
So
the
very much.
week of the crash course review. It is
Gotcha.
different. This is totally different. This is a different ball game right here, guys. This is something you should not skip. If you do, you could probably pass like everybody. This is not something, this is something new. We have been having highest passing rate in the longest time. But this is the newest edition. This was created about 30 days ago. And every night I work until 2 in the morning adding questions. So if you were here yesterday, you have to reset your question number 7 and you have more questions, right? And I only do 65 a day to prevent, not preventing you, hoping that you don't go through all of them in one day. You should take it easy, like 10 days before your test, do one, then you do another. So allow your brain not to be overloaded. 65 questions a day, only the most high yield questions. Okay, we'll talk more about that because today I had someone that did not pass, and then I do an analysis like I always do, and there is lots of holes on the preparation. Didn't do few things that should have done. And to me, that hurts me a lot, because I know had you just completed one thing that you didn't, would have made the difference for you to pass, because 1 or 2 questions you didn't pass. It was right there. I don't know how else to say it. I really get frustrated, because the pass is just a matter of a hairline. One little piece of hair is the difference between failure and passing. Okay. I don't mean to be super annoying, but I want to see everyone to pass. I don't want to lose anybody. And when I do every once in a while, it's always about the same thing. It's not the content, it's because something wasn't followed every single time. Okay.
Hi,
But
Dr. Lopez.
hello.
I passed yesterday.
Whoop, whoop. Oh, that's awesome. So lots of people, guys, a good strategy too. Thank you.
It wasn't
Robert.
easy, but I made it. Thank you so much. I was hearing your voice the whole time, because I got to number 50. I almost gave up. I thought I
Wow.
had the wrong test until I started seeing diagnostic 3 and 4 questions. That's when I was like, Dr. Lopez said, fight till the end. So I started. I almost got up and left.
No.
So I heard your voice saying you gotta fight till the end. Don't give up. So I started. I sat back down and I started reading it over and over. Then I started seeing diagnostic 3 and 4. It gave me hope again. And I sat down and I prayed. After praying, I breezed through it.
Okay.
So
Amen.
thank you so much, Dr. Lopez.
Guys.
Your review is the best. If it wasn't your review, my test was weird, super weird. It was all mixed up, twisted. Questions I never heard before. Diagnostic 1, I made over 90. Diagnostic 2, I made over 90. 3 and 4, I made over 90. When I took them again, I made from 98 to 100. Even the pre-test, I made 78 on the pre-test straight from
good.
school. So it was not like I wasn't prepared, but the test was from another planet.
Yeah.
So
you prepare
because of your
yourself.
review, I was able to pull through it.
That's good. That's good. I'm so happy. Love it. Please send me an email.
I will. Thank you.
Thank you so much for your
Dr.
kindness.
Lopez, for doing God's work. I have not seen anybody that has any program out there that will equal your program in any way. And I make sure I stay on social media, posting you, telling everybody, because people gotta hear about you. They need to know, because that's the only way they can pass. Seriously.
I appreciate it. Thank you so much.
That
And
is
it's
so
not
true.
it's not just me, right? I'm just a small part of the whole system. There is the employees. Sometimes I get very upset at them. I throw a fit sometimes. It's not very normal, but because we try
we
to
gotta
make sure that everything
we gotta
clicks,
share the
right?
joy. We gotta tell other people out there. I stay on social media. I tell everybody. I write everybody that say, oh, they are graduate. I say, have you registered for Dr. Lopez's class yet?
Yes.
You need to
Thank you.
register. I keep telling people, even if they want to, every group I belong on Facebook, anywhere, group me everywhere. I mention your name. I ask them, have you registered for this class? Have you registered for, Dr. Lopez's class, review class? He's the best. Thank me later.
Thank you so much. Appreciate
You're
it very
welcome.
much. And
Thanks,
congratulations.
everybody. Hang in there.
There
Dr.
you go.
Lopez is the only one and only, actually. You're gonna
Thank
pass.
you.
Follow his everything he says. Listen to him. Follow his course. You're gonna pass. If it
Amen.
wasn't
Amen for
him, I
everyone.
wouldn't have passed at all. Although I thought I knew a little bit coming out of school, but no.
It is different, right?
If it wasn't
Totally
his voice
different.
in my head telling me push through it, I wouldn't have passed this board. So
That's
I
good.
thank
That's
everybody.
Yes, awesome.
Bye.
Thank you for the feedback. That is very encouraging. Roberto, are
Thank
you
you.
there?
Yes, I am.
All right.
Good evening, Dr. Lopes.
Good evening.
I
Hi.
just came home and I passed my boards.
I was hoping you'd tell me that. I know
Oh,
you were
Dr.
starting
Lopes,
soon, so that is
God bless
absolutely
you. God
awesome,
bless
Roberta.
you.
Thank you so much for the
God
great
bless
news.
you. God bless
Uh,
Karina, your wife. God bless all your team. It's just like what the girls were saying is right. Like I felt like you were sitting right beside me and I could hear your voice. My test was probably exactly the same test that she had, because the first 50 questions I was just kind of like, Jesus, what's happening here? People said that only diagnostic 3 and 4 was on the test. But
didn't know
it's,
that. I mean, that is, it's all about perception. I'm not saying it's
yes,
true or not true, but the whole course is what makes people pass. It's not people that are say, "Oh, I'm just gonna come to the crash course." Maybe they
no,
pass,
you
but
need
it's
to
the
know the
wrong.
content.
It's the wrong thing. It's the wrong answer. It's seeing the same thing several times that's going to make it stick. When you're in a bind, you don't know what's the answer. Think of what you learned,
Yes,
and fight for every question, because you will feel discouraged. And if you are concerned about the question that you didn't get it right, now you have one that you could, but your mind is back on the previous question. That's not going to work out well for you. Right, so
yes,
fight for every question. That is so important. That is so
yes.
important.
But I can tell you, if people follow you, by the letter, everything that you said was there.
By the letter. Yes.
By the
Yep.
everything that you said was there. It's
Mhm.
just kind of like I even I did a little dump sheet, and I did not even have to use my dump sheet, because every time I read the question, I kind of I knew the answer, but sometimes my answer was there, but something looks a little better was there too. So I just kind of and I could hear you saying, get your answer and stick to it, and go for it, and that's it. And that's what I did. And I left over there crying, because I kind of God, I know that I got it. I know that I got it. And
That's good.
thank you very much. Thank you very much for
Yeah.
letting me stay in the course. Thank you very much for being patient. Thank you very much for have this big heart that you have. People
Oh,
don't understand why you have such a big heart, but because this is your purpose in life. I feel like that's your
maybe,
purpose,
maybe.
to help others. And we know how hard it is coming from another country. And, most of us, like nurse practitioners and nurses, we come from another country, and we hustle here. And God has given you a vision, and please never stop, because
Yeah.
you've been
Thank you.
adding to so much in people's lives that
Yeah.
you have no idea, Dr. Lopes. You and your family is going to be blessed for 10 generations, because it's
Oh man.
everything that you do.
Yes, agree.
Thank you
I
very
agree, Robert.
much. Thank you so much. I'll come back.
Awesome.
I'll come back on Tuesday to talk a little more, because I know the people are anxious.
Sure.
They want to start the Kahoot.
Yeah.
But I'm gonna try to tell you, make your email with the things that I remember. And
Okay.
I'm
Right,
gonna send you an email,
we'll-
because I want to do the pharmacology test too.
Yes. We can
course.
definitely talk about the pharmacology. Send me an email, but I appreciate it,
Yes.
Roberto. Thank you so much.
Thank you so much. And
All
people
right.
hanging in there. You can do this.
Hi, Dr. Lopez. Thank you so much.
Thank
Thank
you,
you so
Lisa.
much.
Bye,
Appreciate
guys.
it too.
Hold on in there.
Bye.
Bye.
Bye. All right, folks.
Hello.
Let me get instructions here if you are new, real quick, and then I'll give another 5 minutes just for 4 minutes so we can get started. If you are new, anybody new here today? So Kahoot is always the same link. Grab your phone, open your phone, your camera, and put on the QR code in the middle of the screen. A hyperlink will show up. Once it does, click on the hyperlink. Create a nickname. You cannot select one here, somebody already selected. And then in 3 minutes, we'll be about to get started. So you have to open your phone, your camera, to the QR code. Click on the QR code or the hyperlink, and then create a nickname. You know you are in the game. if you see your name here. Obviously, more people coming in and your name is going down. All right. So let me just talk to Lynette. He says her hand is up. Lynette, hi.
Hi, how are you?
Good.
I tested yesterday and unfortunately I did not pass. I took the the CC and I didn't pass.
What do you mean the CC? AANC?
Mm-hmm.
Okay. So Lynette, we have to look at your account and then I will point out everything that you may have skipped.
So I went online and someone recommended you. So it's the first time that I log into here. They just invited me to this, so I don't know.
Oh, okay. So you're not in the course.
I'm not in the course. No.
Oh, okay.
I'm like, is this where I'm supposed to be today?
Okay. So I just want to make sure because some people sometimes they don't pass in our course. It's not always 100%. That is the truth, but it's usually because there is some misunderstanding what they needed to do. But Lynette, I'll promise you this: if you follow the instructions, I'll be sending you an email. Read the email, say, I know what I need to do. I know what I need to do every week. I know I have to study. I have to do X, Y, and Z. Stick to the program. We don't charge monthly.
The test seemed like it was from another planet. I'm like, I scored, it said very high on the diagnostic and testing. I've been an NP and FNP for 15 years. So I think my knowledge of like clinical knowledge, I don't know how to corroborate.
No, it is actually, let me tell you a fact. If you have been an MP for a long time, this test is actually going to be harder for you because you think critically.
Yes.
And a lot of the answers are not what you think it is.
No, I was like, this is a psychology test. This is not a clinical test. What are they talking about? Where are these getting these questions at? I wrote down like 100 questions because I have a really good memory. I'm like, I know my content. I have no idea why.
So you are new to the course now. Send me an email. I'm going to provide you step by step what you need to do every week to pass. Okay. Every week, like week 1, you do this. Week 2, you do that. And then I'll put my email here in the chat box. Okay. PMHNP at npexamcoach.com. Send me an email because the most important thing is being set up correctly from the beginning. So that way you have, it's like a GPS, you know what to do, and there will be no surprise at the end, okay?
I know all my content and I know my meds, I know everything. I have no idea, like the test was really, I'm like—
It is a hard test.
Like, what are they talking about? Where did this, why are they asking me? The first like 50 questions, then I panicked because I was like, I only had 2 hours left because I had to read so much. And then towards the end, it started getting easier, faster. But I was already like so anxious because I was gonna run out of time.
No worries, we'll take care of you. This won't happen again. If you follow the steps, the next time you test, you look at the same test or similar, like, oh, this is so easy.
I just don't know if I should sign because I don't have to wait like 60 days to retest.
Yes, which is perfect time.
Or do that.
You need about 60 days to prepare, 8 weeks.
Like, I know my content. It's like, I just need to learn, the strategies.
Alrighty. So thank you, Lynette. We'll definitely follow up, send you an email. So folks, we're about to get started. Is anyone stuck right now that does not know how to log in? You have 1 minute and then we'll be getting started. If you don't know, please let me know. Now is the time. Lacroix.
Dr. Lopes.
Hey.
Yeah, I don't know how to log in.
All right, so open your camera.
Mm-hmm.
Point to the QR code. And then press the QR code link.
Mm-hmm.
Then you create a nickname. And then you know you're in the game when you see your name show up here.
Yeah.
Okay.
I'm not seeing the QR code.
So, or you can open your browser and type it in. That is the harder way. So all you have to do is really point your QR code, your camera to this. Then you see a hyperlink show up. And then you create a nickname. Or you can go to www.kahoot.it, not .com. And then you enter the PIN code is 199 5039.
Hi, Momo.
Okay. And then you create a nickname. All right, so I'll give it here 1 minute, just to make sure that everybody's having the opportunity to play. If you are new to Kahoot, the questions will show up on the screen. 4 boxes will show up on your phone. This is an interactive game. Your goal is to select the right answer. Many of you guys will select the right answer. However, the person that is faster will get the more points. Why? Because the task is 175 questions. You have 1 minute and 20 seconds per question. If you divide 3.5 or 175, it's 1 minute 20 seconds. You have to get off the fence. You have to look at the question and kind of already know what is the answer. So this game is helping you go over this week's content and also helping you be fast. A lot of folks say, hey, I finished the test and I have an hour left, because they practice on the diagnostic test, they practice on the question bank, and the Kahoot will help you with that. So it's not only about knowing the answer, but it's about playing. If you're just setting aside and say, I'll just watch today, that it's okay, but you are missing out. Okay? There is a purpose. So now, I personally don't care, but a lot of people that are playing, they get upset if you put in the answer in the chat box because they're playing, right? So if you know the answer, don't put it in the chat box. I never say anything because I'm all about freedom. Do whatever you want. I don't like to interject. I don't like to kick people out from the WhatsApp. I don't like to do none of that because I think you deserve to do whatever you want. That's my mentality. But I know that a lot of people get upset. So if you're not playing today, don't answer the question, okay? Sorry. I know you want to participate, but it's easy. Get here a little bit on time. Get your camera, your phone. Get the QR code. And then create a nickname. Okay? All right, since we have no questions and we're about to get started, today we're going to cover scientific foundations. It is the same content that we covered yesterday and the day before. Every week, your goal is only one. Complete one module by yourself or with me, and then complete the question bank associated with the module. So here we have 170 questions or so. So your goal is to complete module 1, right? So if we click here, then we know we have questions, right? So your job is, we have 161 questions here. If you want more questions, all you have to do is supplement to module 1. Then you have another 50 or so. So there is not a shortage of questions to practice, right? Now, you have to time it yourself because that way you can complete everything before your test. Rushing is the wrong answer, and almost every single time leads to a bad outcome. So prepare, understand the content, and good luck for everyone here today. Remember, you get more points if you are correct and fast. The game is about to begin. You are going to enter on your phone the answers. 1, 2, 3. Let's do it right now. Boom, done. All right, you got 18 seconds or so. Pick your answer. Lots of you guys did not yet. 10 seconds. Oh my God. Did I pick the wrong game?
The answer didn't match with the question.
Gosh. 1 second, guys, because I think give me a second. I think this is not the correct game, so give me a second, please. Super sorry. Let me see the next question. Did anybody mute the music?
No, you
There's no
control.
music. I don't know what happened. All right, let's try one more question. If that is not the correct game, something did not go right. So let's do one more. All right, so almost 100%. So let's keep on going here. So that is a great question to know. Everybody needs to know curves and tremors, right? That means lithium toxicity. Now, I want to do a bet. Before I show the next question, and there is a reason why the next question is the next question. We had one person that got it wrong this time. I want to see, I would think, let's see if we can get 100%. Unfortunately, I know that we will not. We're probably going to get 20 people that still going to pick the wrong answer. The next question. Very similar. Same content. Slight difference. So let's see. Maybe. So before we go there, I kind of worked on some high yield points for you, right? So I want to talk about a little bit about lithium toxicity, right? Anytime we see lithium toxicity, obviously we have to stop the medication. Now, here's a point where a lot of people get it wrong. It is the medication of choice for bipolar disorder. It does not mean it's the medication of choice that you give it when someone is manic right away. If you want to bring the mania down, you have to start with an antipsychotic, and then you will transition to lithium. Lithium is the only medication that has been shown to decrease suicidality for bipolar. Be careful. This is for bipolar. The only medication that has been shown to decrease suicidality in schizophrenia is clozaril. That's easy concept. You have to look at what is a disease and you pick the correct medication. Now, we need to differentiate between toxicity and side effects, what is expected and what is not expected. We talked about high yield interactions, ibuprofen, idonomycin, right? All these medications will reduce the renal clearance rate and increase lithium's level. Thiazides, diuretics, ACE inhibitors, dehydration, and hyponatremia. I'll bet you money. Lots of questions on how would you know your patient is taking the medication correctly. When I say when you go camping, you would take 2 liters of water with you. When I go play soccer, when I go build a house in Miami in the summer, I'll make sure I'll take frequent breaks. That is patient education, okay? And obviously, lithium is excreted by the kidney, right? So therefore, we need to know our BUNs and creatinine level, okay? Because lithium can cause thyroid dysfunction, hypothyroidism, which mimics symptoms of depression. We need to know our TSH values. And if someone develops hypothyroidism, we can treat with levothyroxine. Lithium is high yield for possible birth defect. Now, we need to know what is the application of that. They will never say which of the following condition lithium could cause for someone that is pregnant. You need to know what is the application. If you auscultate someone's heart and you hear a murmur, can you connect that to abstinence abnormally? And the ethical dilemmas, which is module 5, as you see, one content, it kind of mix and match all the way up to module 5. Beneficence is doing what is good for the patient, but remember, every patient has the right not to take medication, even when under involuntarily admission. Exception, if the court says that one is not able to make their own decision, then they will take it. Okay, so these are some high yield points about lithium to know. Now let's see the other question. How many folks will get this one wrong? Simple question, right? All right, we got 5 seconds. Take your best answer. 4, 3, 2, and go. All right. What did I say? Right? I was trying to be kind and really mindful, but I knew it. One shift of the question would throw everyone in the wrong route. Guys, this is not, or either was lack of attention or lack of content. How is the first question different than the second? One was coarse hand tremors. The other one is a fine hand tremors. Okay, is fine hand tremors expected? Yeah, is a side effect. Is an increase in white blood count expected? Yes. So what should we do? We want to assess for signs of a lithium toxicity and adjust the dose if necessary, right? Remember, what if its lithium is 1 point? So lithium is 0.6 to 1.2. If it's 1.3, does the patient have any symptom? If it's yes, then we stop the medication. If it's no, continue. What if its lithium is 1.4? Again, does the patient have symptom? If the answer is yes, stop the medication. If it's no, continue, right? So here we have expected lithium side effect. We want to monitor, collect lab, but it's not a strong reason to stop the medication. When lithium arise to 1.5, that is not about symptoms anymore. That is a hard stop, right? Now, if you look at 0.6 to 1.2, it connects to the previous point that I was saying. If someone's manic right now in my office, come see me, I would not start them on lithium unless if I want to keep them, watch them for 3 weeks, right? So what do? Start with the antipsychotic, bring the mania down, then you switch to lithium or Depakote, okay? So we need to know lithium toxicity, side effects, how to manage someone with lithium, with bipolar mania or depression, active, right? And remember, continue with continue lithium and switch to an alternate mood stabilizer. It's not necessarily what we want here in this question, right? We wanted to, to this one specifically, want to continue lithium and fine hand trim as expected. We can manage that. Or a thyroid function test to assess for hypothyroidism. I don't even remember the question talking about hypothyroidism, this one, right? And of course, we want to educate the patient on the side effects of lithium-induced leukocytosis. Perfect. We have two true statement. They both hard, right? It is a true statement to assess for signs of lithium toxicity and adjust the dose. It is also a true statement to educate the patient on the side effects of lithium-induced leukocytosis. The patient didn't come to your office to ask about the hand tremors and leukocytosis. They came there to be assessed. Which one of the answers, A or D, would be more important? Educate the patient or monitor for signs of toxicity and adjust the dose if it's necessary? Okay? Lots of questions. You will come down to 2 answers. And then you have to ask yourself, which of the answer would solve the problem? Okay? I get it. It is a hard question. But if you knew that fine hand tremors and leukocytosis was expected, it would have led you to the correct answer, which would be to continue, monitor, and make adjustments if needed. All right? There was a reason why I put this question immediately after a question in which you would discontinue, to make sure that we can drive this point on. Okay, we got 10 seconds. Pick your best answer. And 3, 2, and go. All right, another hard question, right? Even though I don't fully agree with B here, lithium does modulate glutamate receptors and reduce impulsivity. So the core of the question is, why is lithium helpful for those with suicidality in bipolar? And this is the answer. There is a lot more to this answer. This could be a whole paper only on the answer, how it regulates glutamate and so forth, and where it acts. But a lot of that is very convoluted anyways, okay? Now, lithium, primary mechanism is in reducing suicidality. So I wanted to make that point very first in the first question, right? The only medication that has been shown to decrease suicidality in bipolar, okay? So hopefully things are connecting from our lecture yesterday. right? And it doesn't really affect so much serotonin or other neurotransmitters there in terms of dopamine, acetylcholine, right? That is more towards serotonin syndrome in a
Dr. Lopez.
specifically serotonin, right? Now, why did I put an unrelated answer to the question here? Well, we got it that lithium decreased suicidality in bipolar. But what a lot of people will get it wrong, a lot, maybe 50%, is when you have the same question, similar question, and asks you which of the following medications would you most likely prescribe for a bipolar depression? And the test is so weird that would say lamotrigine, option A, because all students love lamotrigine. To talk about lamotrigine, you know, that would be the wrong answer. You want to pick Latura, right? Is FDA approved for bipolar depression. I even highlighted made it so ugly for you here. And I don't care about being ugly. I care that you pay attention and get the question right. So if you are asked which medication would you most likely prescribe for bipolar depression, everybody should say Latura. It's not only Latura, right? Olanzapine fluoxetine combination is also FDA approved. Most of the time, not so much as tested as Latura. What we need to know about Latura and Geodon? Take it with food. Otherwise, the bioavailability of it is going to be decreased. So I made a little bit of chart here. So we talked about lithium and heart defects, right? Talked a little bit about that can cause hypothyroidism. Lamotrigine, we have to watch out for Steven-Johnson syndrome, right? How do we prevent it? By giving it slowly, 25 milligrams every 2 weeks. Quitapine, I love quitapine. It works super well for bipolar, works for the major depressive disorder. Do not prescribe right away. You know, if someone comes depressed, only for depressive episodes that are resistant. And Latura must be taken with food. Please remember, bipolar depression, these two are your go-to medication. Yeah, this actually works really well as well. For the test, Latura, right? Out of those three, is the skinny drug that causes least metabolic syndrome. Start with that one. Better choice. Okay. All right, we got 10 seconds. Pick your best answer. 5, 4, 3, 2, go. All right, so good. So this is lithium toxicity. Sometimes they Thales Lopes to talk about lithium nephrotoxicity, what that looks like related to kidneys, right? Or lithium gastro complications, then you would pick that one. And this has nothing to do with serotonin syndrome, folks. If you are in my class, and I don't mean no harm by this, and I mean no harm, but I'm serious. I'm dead serious. If you're in my class and you have been with me for at least over a week, and you pick serotonin syndrome, and I mean no harm, or you know, we got to have a conversation because things are not going well. We got to adjust it, okay? We really do. And that means I'm not trying to make fun of you, but if you pick serotonin syndrome and you are in my class, we gotta talk early and soon. Okay, we have to separate serotonin syndrome from neuroleptic malignant syndrome because the test will be full of those questions, and they will not be easy. The sooner we realize it's not an easy test, the easier it gets for us to get in the mode, study every day, set a schedule. Okay. So we talked about lithium have a narrow therapeutic window and what does it mean to our practice. Lithium can cause GI symptoms, neurological symptoms, right? Confusion. So how do you know this was actually toxicity? Let's give an example. No one has persistent diarrhea 24 hours a day. What if it's constant diarrhea? Nothing that is persistent, constant, explosive, projectile is normal. And that works for every medication. There is no medication out there that give you constant headache, meaning 24 hours a day. That is not a side effect. It would never be approved. That is most likely leading to toxicity. So what does it mean for you? That's taking strategy. Constant, nonstop, projectile, severe. These are all keywords for not normal. Okay? So that is a keyword for toxicity. Three, two, one. All right. Keyword. Decrease renal filtration rate, decrease renal excretion. This is how it affects renal. And I put it almost the same thing as by saying increase, into hoping that somebody would kind of get those two confused so we can get it wrong now so that we don't get it wrong later. And has nothing necessary. I mean, it does have a lot to do with the GI, but it's not the primary reason why lithium toxicity occurs on dehydration. Okay, good job. So, all right, I'll put in a pin code. Someone else asked what's next here, so I can give you a pin code and you can join the game. All right, 5 seconds. Make your best answer and go. All right, perfect. Very well. We do not want to increase sodium, right? We definitely don't want to be hyponatremia either. We don't want to avoid sodium either. And we don't want to eliminate caffeine as it interacts with lithium. Very minor interaction. It does interact, but it's not that serious that we need to eliminate caffeine. Now, keywords. If I just got out of high school today, and let me see, avoid all. Nothing psychiatry is all, always, 100% of the time, every time. When you see keywords like that, all, every time, 100%, you kind of know that is the wrong answer, okay? So be careful. We talk about strategy to avoid those very strong words, because they rarely, if ever, is the true solution for anything, especially in psychiatry. All right, Psych mean took the lead, right? So maintain, what you want to do really is maintain a constant level of sodium. So is when you collect your labs, you want always to be in the morning, or a rhythm, right? You don't want to be taking your lithium in the morning, go collect your labs, right? You want to be steady, not much of a variation, so it doesn't give a false positive or so forth. All right, we have 10 seconds. Pick your best answer. What would I say to a pregnant lady that wants to get pregnant? Yes, you want to gradually taper off and explore alternative mood stabilizers, such as lamictal, right? Now, let's kind of think about this scenario a little bit more. A strong answer, pay attention because that is likely to be in your test, is to collaborate with OB. Okay, collaborate with OB. Now, another similar question, let's say someone is pregnant and on lithium, are you going to tape it off? No. If someone is pregnant on lithium, you need to cut it off and switch it to lamotrigine, okay? Can be very harmful to the fetus, specifically in the first trimester. Okay. All right, Psych me still on the top here. All right. So yes, lamictal would be your mood stabilizer of choice for those that wants to be become pregnant. The drug of a choice is lamictal. There is no safe, 100% safe drug, right? But it's the most studied, has the least effect on the fetus. That would be your drug of choice, specifically if someone is pregnant and wants to be on a medication. Lamictal is the name of the game. Students will do this question right because I yelled in their lungs about this. All hard, 4 choices are hard to select. All right. 5 seconds. Take your best answer and go. All right. I'm proud of you guys. So it's a hard choice. It is one difficult to make for the board. The board is all about safety. Now, Stevens-Johnson syndrome, as I yelled yesterday so many times and the day before, it does not go away. It needs ICU treatment. It's deadly. It can be deadly. Okay? So rashes that disappears are more likely than not to be benign. Therefore, continue the medication. Now, what if you have a patient with no rashes whatsoever and fever? Do you continue or discontinue? You stop the medication. What if you have a patient with no fever and no rash, but has angioedema? Do you continue or discontinue? Discontinue, right? So now we have our limits. If it's Stevens-Johnson syndrome, rush the patient to the ED immediately. If it's benign, it went away, no fever present, continue the medication. Any signs of fever, stop the medication. Any signs of angioedema, swallowing of the tongue, I don't even need to say anything else about that, right? If you can't breathe, you need to stop the medication, right? All right, benign rash, continue the medication. But you need to document, okay? Stevens-Johnson syndrome doesn't go away. Once it starts, it's hard. Hard stop, fever, angioedema, or severe rash, right? Now, be careful, everyone. Lamictal and an inhibitor called valproic acid will bring lamictal to toxicity, close to 100%. So what you need to do is reduce your dose of lamictal by 50%. We have an inhibitor and a substrate. The substrate is the lamictal. For some reason, valproic acid is being used, so the lamictal, the substrate, needs to be ordered or prescribed at 50% of what you normally would, and you need to monitor carefully because this inhibitor here, valproic acid, could lead your patient to Stevens-Johnson syndrome. Okay, 10 seconds to take your best answer. 4, 3, 2, 1. All right. Very good, everyone. So super happy to see that. So thank you for that. So anytime we have someone, FDA warnings for Depakote, we need to know pancreatitis and liver toxicity, right? So we need to get our labs. But the question will never say which of the following are FDA warnings of pancreatitis or of FDA warnings for Depakote, but it will give you symptoms of a pancreatitis and liver toxicity, and you need to know, stop the medication. If you're getting a call, go to the ED immediately. Okay, so these are black box warning. All black box warnings are important. In terms of a pancreatitis, we need to get amylase and lipase level, pancreatic enzymes, right? So for Depakote, ammonia, pancreatic enzymes, and LFTs. Perfect. Now I want to just go over a little bit more. Emergency, these are medical emergency, right? Severe abdominal pain, specifically that had radiate to the back with combination of nausea, vomiting, fever, rapid pulse, or the hallmark of pancreatitis. So you need to know this right here. Tons of questions on pancreatitis. So how would you know? They will never say pancreatitis. They'll give you the description. And they don't really care too much about that. They care what is your action. Your action is ED. Go to the ED immediately, right? So you want to send them to the emergency department. So what a pancreatitis looks like, we just talked about that. Severe upper abdominal pain that radiates to the back, oily stool. That is key words for pancreatitis. How about hepatotoxicity, liver toxicity? We look for the upper right quadrant, yellowing of the skins, jaundice, reddish tea like Coca-Cola, dark urine, right? And in all those cases, the first thing you do is stop the medication and proceed to the ED, right? So also remember, what is the normal levels of Depakote? 50 to 125. If it reaches above 150, that is toxicity. What a toxicity looks like: confusion, difficulty breathing. These are also alongside pancreatitis and hepatotoxicity. We need to know what levels of toxicity looks like on the patient, right? Disorientation, lethargic, respiratory depression, nausea and vomiting. These are signs of toxicity. Remember, 50 to 125. If it reaches 150, toxicity level. Okay. All right, we got 10 seconds. All right, just like Depakote, carbamazepine, we need to be concerned about the FDA warnings: agranulocytosis and aplastic anemia, right? We need to know what an agranulocytosis looks like and also aplastic anemia, right? So in this clinical presentation, fatigue, pallor, petechiae, small reddish spots throughout the body under the skin, right? Indicate bone marrow is not producing enough blood cells, right? So because of this condition can be fatal, you need to stop the medication immediately. Order your complete blood count, CBC, is your priority, right? And you wanted to start looking at the differentiation between liver issues that can occur with Tegretol. They could also be present with jaundice and the right upper quadrant because it is metabolized by the liver, but would only treat simple anemia, and would be dangerous if the underlying cause is true bone marrow failure. We want to, anytime someone is on clozaril or a carbamazepine, we need to be very, very, very concerned about agranulocytosis. If they sneeze, if they have a mild fever, if they have a sore throat on any of these medications, we stop the medications, and we do not need to see any ANC levels to stop the medication because of the risk of agranulocytosis. Right, 5 seconds. Okay, BUN creatinine is super high yield for kidney. ALT, AST is liver, right? Which has nothing to do with lithium. Okay. Out of BUN and creatinine, creatinine is the most indicative how well the kidney is performing, right? A decrease in GFR would suggest that lithium might accumulate to toxicity. While lithium can cause hypothyroidism, TSH and T4 are endocrine markers, not renal. Ask yourself, which lab is abnormal here? All right, 5 seconds. Pick your best answer. All right. So BUN and creatinine, 10 to 20. Normal. TSH, right? We have 0.5 to 5. Normal. And then 7,000. White blood count. It's not abnormal that we would be concerned, right? So white blood count typically anywhere between 5,000 to 10,000, just a little bit, you know, some labs may say 4,000 to 12,000, 7,000. That's where we want to be. Good numbers there. Lithium can actually cause a rise of leukocytosis. What's the harm with that? Not something to be super concerned, expected, usually benign, right? But when we have a creatinine level above 1.2, even though it's not as serious at this level, it's still the only lab that is outside the normal, and they could start to indicate a potential renal insufficiency, right? And we need good kidneys in order to excrete lithium and keep sodium in, right? So we need to continue to monitor. It's not necessary to stop the medication, but we want to monitor and assess.
Just a minute.
Everyone's this question, right? All right, 8 seconds. And go. Yeah, we want to detect agranulocytosis, right? So we have to be very careful with carbamazepine, clozaril every single time. And I'm not exaggerating for the board, not real life here. If they sneeze and ANC level is 2000, stop the medication, okay? Even if they sneeze, mild fever, because we are very concerned about agranulocytosis, okay? So the board loves to present someone's feeling well, everything is going okay, with temperature of a 100.005 or something like that. Or just a little bit of malaise or a sore throat, you need to stop the medication. Now, if you want another point on your board, make sure you know how to collect labs on clozaril. 6 for 6 months weekly, bi-weekly for the next 6 months, and then monthly. If you didn't know that, you need to write it down, because that will come handy for your test. That will be on your board, folks. We cannot play with clozaril. What are the 2 medications, antipsychotics, that cause most weight gain? Clozaril and olanzapine. If we think about clozaril, we got to think myocarditis. We got to think of excess of salivation because of acetylcholine, right? And olanzapine, everybody knows that patients will get a little bit extra weight, and we need to manage how? With lifestyle modification first, and then switch to skinny meds, Latura, Geodon, and Abilify. Severe food restriction leading to low body weight. We need to know bulimia versus anorexia in detail. Most importantly for psychiatry, what is refeeding syndrome? When do we call CPS? What are the criteria for admissions in anorexia? Folks, it's a lot of content, okay? It's a lot of content. And I pray that you are listening to me right now and you're not just thinking that I just want to make you work hard for no reason, okay? The sooner you get on board that you need to be studying, this is for you, the better will be for you. And I'm here to help you, okay? Let's talk about anorexia and bulimia. How are they different, right? Someone with bulimia usually have a significant low body mass. Someone with, sorry, anorexia have a significant body weight, right? Low body mass. Someone with bulimia, they have normal BMI or slightly under or normal BMI, overweight, right? So that is the first thing. How about patterns, behavior patterns? Anorexia, they look at the mirror and say, wow, I am so fat. While bulimia, they do compensatory mechanism like laxative purging or excessive exercise, right? One with anorexia, they usually have a low BMI, anywhere between lower than 18, okay? One with anorexia, they may deny they have a problem. They don't see it as a problem. That is called ego-dystonic. Ego-dystonic is when one has a problem and they kind of know they have a problem, so they seek help. For example, OCD, right? They feel actually guilt and blame themselves and distrust, and they know it's a problem. They know it's not reasonable to wash hands 30 times. They seek help, right? So we need to know what is a refeeding syndrome, what kind of electrolytes are imbalanced when someone eats a large meal. Right. So smoking has no significant effect on Zoloft, but pay attention. Smoking, not necessarily the nicotine, but the burning down of the chemical in smoking, has a significant effect on which antidepressant. Which antidepressant has a significant effect with smoking? Bupropion is 2D6, so no. Duloxetine. Guys, I ask antidepressants, right? Not antipsychotics. Obviously, quetiapine, risperidone, olanzapine, clozaril. Yes, of course, we know that, but I want you to know duloxetine. Write that down. Duloxetine, everybody should never get a question wrong when they are referring to CYP1A2. And obviously, everybody knows Zyprexa and clozaril, but not a lot of people know about duloxetine. Please know duloxetine. That is super high yield. Okay, I just created a question like that 3 days ago, 2 days ago in the crash course review, because I know there is not a lot of people talk about duloxetine. Okay, so sertraline is metabolized primarily by 2C19 and 2B6 and sometimes 3A4, right? Now, duloxetine, clozaril, olanzapine, quetiapine, it's all metabolized by 1A2. You need to know 1A2 pathway because it's super high yield for the board, okay? And as again, it's not necessarily the smoking nicotine, right? But it's the chemical in it, hydrocarbon in the smoke itself, that causes the interaction, not the nicotine per se. Shouldn't smoke anyways. All right, 5 seconds. All right, so we just got like another text, someone passed the board, so that is always great. Lots of folks are doing well, so I couldn't be happier with that, right? So it's always a good feeling, you know you crossed that finish line. So you want to stop lithium and order lithium serum. Guys, have you noticed persistent, consistent, non-stopping? It's always toxicity. It's something that we can just get it and kind of like, okay, if it's unclear, you shouldn't have non-stop diarrhea or vomiting. That is toxicity level, right? I mean, nothing should go on for 24 hours other than a migraine if you have migraine, right? So, but it should not be a side effect of medications. We're looking at toxicity level. Sometimes it's just a settle, looking for the keywords, understanding what are the keywords, how it's going to help you find the answer. Even if you don't know the answer, if you look for the keywords, you kind of get the answer. Okay? So lithium toxicity, always want to stop the medication. Objective data, lithium is the only way to confirm, toxicity is confirm labs, right? It's the only way to confirm toxicity is to determine the patient requires emergency intervention like hemodialysis. If lithium level reaches above 3, then I'm concerned about hemodialysis usually, but it never gets that bad on the test, right? But in real life, it could. Okay. All right, we've got 5 seconds. All right, so I'm hopeful that if you picked serotonin syndrome before, you picked again for this question, right? So you would be concerned about serotonin syndrome. We have a Praxil and venlafaxine together could lead to serotonin syndrome. Now, here's a hard question. Let's pick any 2d6 CYP 500 in conjunction with metoprolol. What we would do to metoprolol? You can say Wellbutrin, you can say Praxil, you can say Prozac. These are all 2d6. Why would I care about the 2d6, any one of those three, with metoprolol? Am I concerned about serotonin syndrome? No, I'm not concerned about serotonin syndrome with metoprolol. What would I be concerned about? Hypotension, right? Hypotension. So please write that down. Just like this other cue that I gave you about duloxetine being taken with someone that's smoking, we talked about that. That is good information. That's really good information. So now you know 2d6, Wellbutrin, Praxil, and Prozac do not mix with metoprolol. And guys, I am exaggerating. A lot of people take together. But what we'll do is inhibitor of metoprolol will increases the level of metoprolol, therefore risking hypotension. Okay. And we don't want to like two SSRIs, MAOIs, CCAs usually giving together. Okay. All right, we talked about this in detail about neurotransmitters yesterday. Everyone should get it right. Most abundant and excitatory neurotransmitters in the body is almost 80 to 90% of all neurotransmitters is this one. All right, 5 seconds left. Right, glutamate, right? Chief inhibitory, GABA, right? If someone has a lack of GABA, which psychiatric condition we would be concerned of, right? We'd be concerned about anxiety. Too much glutamate, we would be concerned with psychosis along with dopamine, right? And think about alcohol. Let's talk about that because that is super important. Think about glutamate and GABA. Whether someone is acutely drinking or drinking every once in a while, 21 years old, glutamate will be decreased while GABA will be enhanced. As the person drinks every day and becomes an alcoholic, now the reverse will happen. Now glutamate will be increasing while GABA will be decreasing during withdrawal symptoms. Do I need to know this? I can bet you money. So what is the interaction between glutamate and GABA, whether acute or chronic / withdrawal? What else do we need to know? Substance use disorder. Dope and GABA are the two neurotransmitters involved in substance use disorder, dopamine and gabapentin. It makes sense, right? A real word, feeling good, pleasure, dopamine. GABA, think of a benzodiazepine. Pregabalin, gabapentin, so many, even alcohol potentiate GABA. All right, we got 10, 11 seconds. Pick your best answer. All right, so if you pick A, please know the cerebrum is different than the cerebellum. Okay, cerebellum, it is all about balance. The cerebrum is where it houses 83% of the brain. It's like the CEO. That is your lobes, parietal lobes, frontal lobe, occipital lobe, right? Temporal lobe. Cerebellum is all about balance. Limbic system is all about emotional connectivity, learning. Brainstem is what we need to live. We need our heart rate or our blood pressure. It's all coming from the brainstem. Also, dopamine, the Raphael nuclei of the brainstem. Okay. All right. 4D mom PMHNP, you go. All right. So that is the function of the cerebrum. It really is modem control, balance, right? The Romberg test. You guys remember the Romberg test in nursing school, right? That is important. Always remember the Romberg test and the cerebellum. Okay. I'm going to take a picture of this question so we can talk about it often. All right. Okay. Expressive speech. Which brain region is most likely? Yeah. Which brain region is most likely? Which brain lobe is most likely associated with expressive speech? Frontal. This is receptive speech, right? So I wanted to kind of, because once the question is gone, I can't read it and I don't remember anymore. So we got a 45 years old that presents with a history of complex partial seizures characterized by outer consciousness and repetitive behavior such as lip smacking and pecking at clothing or clothes. During the assessment, you observe that the patient has difficulty recognizing familiar faces, understanding expressive or receptive language, particularly complex sentences, renikers, right? They often struggle with forming new memories. Where's memories is which lobe is affected by memories, and exhibit changes in emotional response, where we talked about yesterday. We listen for expressive language, memory, and we keep our emotions. That is all your temporal lobe, and that's all you need to know about temporal lobe. Understanding language, keeping our emotions, right? And the memories, understanding, and how we feel after that, it is your temporal lobe. Okay. So we have sometimes to think a little bit through, other than what is given in the course, how does it affect someone in real life? Okay, so that is a typical board question. Not very clear, but you know the content. If you do, you would be able to figure it out. If you have doubts, it's because you understood when it was said this week, but the application is gapping. So you have 161 questions. You have probably over 200 questions for module 1 to make sure you get the practice that you deserve, so you are test ready. Partial coordination, parietal lobe, constructional apraxia, asterognosis, ability to recognize an object by touch alone without sight, inability to build a clock, whether it's mini-cog, MMSE, MoCA, slum. That is all your parietal lobe is partial, where you are in space. When someone draws a clock, put the 6 where 1 would be, right? Not good. That is the parietal lobe, okay? If someone doesn't remember where they were last week, and I mean by that, if you were in an important event, right? Not that you don't remember what you had for breakfast. It doesn't mean you have dementia, but you know. All right. I don't remember what I had for breakfast. I don't even remember if I had breakfast, right? Not the same thing. All right, what is the difference between first generation and second generation of psychotic? How are they different? Do you remember what I had last night? Or was it have anything? This one should be fairly easy, right? It's help you tell how the generation will work, will different. All right, we got 5 seconds. Take your best answer. 100%? All right. Second generation is also called atypical antipsychotic. So if you didn't know that, it's called atypical. Why is it atypical? Because they added something called 5-HT2A, which is serotonergic antagonistic. Okay, so when we talk about the first generation, they were very potent antipsychotics. That is a true dopamine antagonistic properties. Why? Well, if you think about psychosis, the psychosis is postulated that there is an increase in dopamine where? In the mesolimbic of the brain. So they created first generation. The problem with first generation is that it blockades dopamine at 80% level everywhere. When it does that, it works really well to bring the psychosis down. Now, how about the other three pathways? The mesocortical, the nigrostriatal, and the tubulofundibular. All three other pathways, there is a decrease in dopamine. When you have a decrease in dopamine in the nigrostriatal pathway, then you have an increase in acetylcholine. Now you have EPS. How about in the tubular fundibular, when you have a decrease in dopamine depletion, no dopamine, right? Prolactin is disinhibit. Now you have galactorrhea, galactomastia, and so on. Decrease sexual libido, right? And also neurosis. So how is it different in second generation? They said, well, let's create a medication that does not blockade or deplete dopamine as much. So first generation 80%, second generation 20%. And by this a little bit decrease in blockade of dopamine by adding the 5-HT2A to the medication, which is serotonergic, now it blockades a little bit more, less, therefore less EPS, therefore less acetylcholine combination, and patients have less EPS and tubulofundibular pathway signs and symptoms, right? So you need to know that the second generation or atypical antipsychotics comes with 5-HT2A receptor. That is the basics of the basics. Okay, that is super important that you know that. That is a high yield concept, and just by what I explained it alone, you could easily calculate 10 to 15 questions, easily. Whether it's going to be direct or which pathway is being affected, which condition is most likely be involved with modem dysfunction, galactorrhea, also neurosis, which other neurotransmitters are fighting where, right? Whether it's nigrostriatal or prolactin, nigrostriatal, acetylcholine, and prolactin, tubulofundibular pathway. I will get 7 seconds to take your best answer. All right, so we kind of went over this on the previous question. Other than the mesolimbic pathway the problem is a decrease or depletion of dopamine in the mesocortical, tubulofundibular, and nigrostriatal. Okay? So the atypical second generation fixed that problem to a certain extent. It restores the balance of serotonin and dopamine where mesocortical pathway. It restores the balance of dopamine and acetylcholine where to nigrostriatal, right? And restore the balance of a dopamine and prolactin in the tubulofundibular pathway, because dopamine is not really depleted at the 80% level, it's depleted at the 20% level. We need to know this really well, okay? So as you notice here, the problem is too much dopamine in the mesolimbic, but too little or depletion or lack of in the mesocortical, nigrostriatal, or tubulofundibular. If you ever answer the question, you need to always answer in terms of dopamine, because it would be a true answer to say that acetylcholine increase is the cause of EPS in the nigrostriatal pathways. True, but think of the domino effect. Who fell first in order for acetylcholine to rise? Dopamine. If dopamine wasn't low, acetylcholine would have been like high, right? So always answer in terms of dopamine, never in terms of what another neurotransmitter is doing. Okay. Right? It's a hard question, okay? Very hard question. We kind of need to differentiate TD versus parkinsonia. Okay, very hard question. I'm glad that most of you guys really got it right. Parkinsonia is slowing down of the muscle rigidity, pew rolling, shoveling gait, but they do kind of look similar, but I do get it as it was a hard question, okay? So let's take a picture. Hopefully, we can talk about this case here in a second. All right, so I guess we don't need to talk about it because 110 of you guys really knew this is NMS, right? With what gave us away, right? Admit on psychiatric unit for mania. She started on high potency antipsychotics. So if you think of an NMS, always think of antipsychotics, at least for the board. Okay? The psychiatric board. So today she is febrile. That's the first clue. Diaphoresis and exhibiting generalized severe muscles rigidity, lead pipe rigidity. She is muted. Mutism only see on NMS and not on serotonin syndrome. And demonstrate an outer level of conscious can happen on serotonin syndrome and NMS. Okay, her vital sign shows tachycardia. Labs, which happens on both, labs reveals elevated CPK. CPK only on NMS. What else? Impaired liver function. Then we kind of have the full picture, right? That we're talking about NMS. We know what caused it. It was a D2 antagonistic. We have mutism, lead pipe rigidity, elevated CPK, myoglobinuria. These are all very specific for NMS and not serotonin syndrome. For the mom, you rock. You keep in first place and you're not letting go. Good job there. So, yeah. So I want you to focus on how is it different than than serotonin syndrome, because fever, values, stability, that is kind of the same. But lead pipe rigidity, right? Lead pipe rigidity would be an MS. Rigidity and hyper extended reflex and clonus or myoclonic jerks, muscle twists, serotonin syndrome. That is one of the highest points you need to remember here. Okay. All right, we got a few more questions to go and then we're almost done for the night. All right, so we need to know inhibitors and inducers, but we also need to know medications that can cause mania and medications that can cause depression. Once we have the four pictures or four acronyms that we provide in a course, then we can look at the question, say, is this an inhibitor or is it an inducer? Is it a medication that can cause mania or is it a medication that can cause depression? Now, if we know that it is one of the medications that can cause mania or depression, we have two options. What are two options? Increase what we have control. Well, I hope, it works for this one. So what we're going to do is increase olanzapine. Option 2 is very high yield for this question. It could have been option 2, but it wasn't provided. Collaborate with PCM to decrease steroid medications, in this case prednisone, I believe, right? We have to take the time. I provide you the acronyms of medication that can cause Mania and depression, it's not easy, but if you do it early, you don't have to suffer a few days before the test trying to memorize it later, right? So this is a clear case of mania induced due to steroids. Now, again, the board will never say steroids. What will say? Prednisone, uh, testosterone, corticosteroids, right? So you have to know what a steroid looks like. Anything that ends in O-N-E, most likely an steroid. That makes it easier. So in this case, we can increase olanzapine to account for the prednisone, O-N-E, for steroid.
Wait, was it go with you outside?
I know you really want to listen.
All right, so take a full glass of water for absorption and GI protection would have been the best answer. You don't want to avoid water altogether. You don't want to mix necessarily with caffeinated drinks or mixing lithium with a small amount of water. That is far from what we want to do. We want them. We want to give them a gallon of water, for the whole day. Okay, especially if they are in the heat, right? Good job, everyone. So now we don't have the music, unfortunately. Master PMHNP, that is your name. Okay, 4D Mom, you lost your first place. Oh no. Okay, so Amber, it's okay. Okay, so good job, everyone. Davey and Luna. I know Luna been scoring high all the time. Folks, it's extremely hard to be on the podium, so let's give them a hand here for those folks. That means you really are the top dog. A lot of you guys were so close, but Kahoot is extremely hard. You don't make it the podium unless you really understand your content, right? You don't make the podium unless if you really understand your content. You get, it's not enough to be correct. You have to be correct and fast, okay? So what I'm going to do for you, if you go to Kahoot.com and search Dr. Lopes with an S, not with a Z, L-O-P-E-S, or if you search NPExamCoach.com, NPExamCoach.com, I'll leave the game open. You can play it again. From now on, I'm going to help you even more. I'm going to leave all the games open. You can play as many times. We have tons of games, right? But this is kind of like the summary of today's event. You can play it again. I'm going to leave this back open. From today and on, all the games will be open. Anybody wants to go practice, go ahead, pass the board. This is too important to be holding information back, okay? I just want everybody to pass. I really, really do. I can't take it. It's by on me, okay? I just can't help it. So what we need to do, if you are testing soon, for God's sake, please don't skip those steps. Let me share with you, okay? If you skip any of those steps and you don't pass, I'm going to be super upset. Okay, I'm going to share with you the 4 documents you got to review. You can't skip that, okay? So what is the first step to pass the board? Obviously, you've been in the course, you have done the 5 modules, we have been through the crash course review, and you are testing next week. What do you need to do next week to pass the board? Okay, I'm going to show you step by step, so it's very, very clear, so that there should be no confusion. Unless if you don't want to do it, I get it. But if you want to pass the board, this is the final step. Okay, under your module 6, under your crash course review, there are 4 documents. Dr. Lopes, should I review document just number 1 and 2? No. I put in days and nights and many hours to create those documents for you. They are super high yield, right? So we have 4 documents. Somebody that just passed the board yesterday said, Dr. Lopes, I am so thankful that I opened the crash course review highlighted document. I even highlighted even line that you need to know. Super high yield. So we have crash course review day 1, day 2, highlighted, and somebody said, I have troubles with medications and neurotransmitter. Can you help me? Then I created the neurotransmitters and medication document. This is where? Under your module number 6, if you are in the full course. How do you get there? Go to all trainings, then you will see all your modules here. Go to module 6, and now all the videos on module 6 are available for you. Then you click the first video of the document that you want to get hold of. Each module comes with documents, right? There is no need to take pictures. There is no need to be writing down things excessively. I want you to pass. I'm not holding back this information. Can you watch the crash course review? Yes, you can. You can just
With the
press play and
healing
watch it again.
stick?
I'm going to go
Most
over
likely
again and
not.
again and again with you.
Again, this is a
Okay?
culture.
So that is number 1. Review every line of the crash course review. Okay, got that. That is easy. I know where it's located. Should be no problems, right? What is number 2 I have to do before I test? Well, number 2, you have to do the question bank at minimum, right? I'm not asking you to do the whole question bank. I'm just saying at minimum, you should do the crash course review question bank. Okay, so where is it located? It is located right here. Let me open up here. Give me a second, folks. So that way I don't show anybody's name that is in the course. 1 second. So this is the crash course review. Is it different than the free questions, the 600 questions that I give it up? Okay. This is only for you that is in the course, that you are in the full course, or you purchase separately. Okay. I can't give stuff away if I charge you. It's unfair. Okay. Where is it located? It says must complete crash course review. Now, I bet you, I mean, I wouldn't say that because today I probably need to sleep. I haven't slept in days. But tomorrow, I'll bet you there will be more questions, number 7. So if today you finish number 7, and there are, I don't even know how many questions are here. Here's we are probably at what? 46. I'll bet tomorrow will be at 55. If you go any other day, right? There is always 65 questions on each of those days. Oh, I don't see it. Expand and contract. Moves up and down. You got more questions. I want to practice therapy. Have you already done your main modules on therapy? Yes. Then you can come over here and you do questions on therapies. Go at it. If you're all like me and love to do questions, there is no shortage of questions. You can do as many as your heart content. Should be no reason for not passing. Okay? We give you everything. Now, what is the last step? How do you know if you are going to pass the board? Okay? This is this. I don't care what you have done in a course. I really do care. But let's say that I don't. If for whatever reason, you come to the end and you score 80% the first time. I had a student today said, Dr. Lopes, I worked so hard. I scored 90 on my tests and I didn't pass. I said, well, let me hear this right. What? Yeah, I scored 90 on my test and I didn't pass. Then I went to look at it. Not necessarily true, right? If you took the test 4 or 5 times, it doesn't count. This is your final, right? And I'm trying to make it clear that there is a huge difference between scoring 100 after you just took the same test and you score 60, right? You know you will pass with the 90%, 95% to 97% probability if you take those 4 tests here, diagnostic test 1, 2, 3, and 4, the first time, and you score more than 80. The second time is great, but now you have seen that answer, it doesn't really count anymore. So your goal is to prepare in such a way that when you arrive at the end of the course, you know you will pass. Okay, there is no surprise. You can probably skip everything. You should never do that, right? But if you do and you arrive here and you score 80%, you know you will pass the board. You're already. But the only way you get 80% is if you don't skip stuff, because there's a lot of information. Again, you can choose to just do the videos, you can choose to do the lives, you can choose to do both. I recommend both. I don't charge you for extra, right? So why not? I recommended 8 weeks of intensive study so that there is no disappointment. We walk you through it. A lot of people say that after 8 weeks, 10 weeks, they learn more in the course than they learn in 2 years. It's hard to believe, but I get that almost daily. But we go through a lot of things. We explain it in different ways. I answer about 100 emails a day. So if you ever have questions, what you need to do is email me. Please don't send me text message. I don't work with my phone, because if I stop, the moment I grab my phone, I cannot not answer questions, right? If I go in question bank or WhatsApp group, I'm there all day now, because I can't resist not answering. I just can't. So in order for me to be able to eat and shower, I have to be working very hard on my emails. So that's the only way you can find me is via email. Okay? So the course works for both ANCC, ANP, it doesn't even matter, as long as you do it correctly. Okay, so it's not necessarily, does it work one for the other? Sure, we'll follow one blueprint as ANCC, but how many of our students have passed both? We had one that passed now, and she will take her other board in 2 weeks. She will pass it again. You can write her name down. I promise you she'll pass it, because she did everything. I looked at her account, I was like, man, there is no way she would not pass. I already know if we're going to pass. How many of you guys I told you not to test? You're not ready. How do I know? I look at the diagnostic test. I look at your crash course review question bank. If you're not scoring 80% consistently, I would not test, right? And I'm not saying this because, oh, I want you to pay more. It's free. Other people would say, please go, get out of here. I say, no, you're not ready, because I don't want to see you coming short. Okay. All right. We got a few questions. I really have to go. I'll answer those 5 questions, but I have to eat. Haven't ate all day, probably. Jeanette, go ahead. What is your question?
Hi, Dr. Lopes. I asked this
Guys, I think it's my sound that is not working.
Can you hear me?
Because I cannot hear you.
TV off.
Was the music on?
Can you hear me now?
That was my camera. So give me a second, please. Okay, so it's my mic. So it's the problem is actually it wasn't. Go ahead. Oh, okay. So I had my if I couldn't hear anybody before. So my sincere apology. I thought it was the Kahoot. It wasn't working. All right, Jeanette, go ahead. What is your question?
So my question I had asked it yesterday, but I don't know if you had answered it. So I remember I saw a test question on a pregnant woman on opioid use disorder, and the correct answer was methadone. And I believe it had buprenorphine. So, because I was thinking cardiac risk associated with methadone, but
So
is this
I don't know the scenario, but I'll give you an answer in which is buprenorphine and it is methadone too. So I would say I am 80% inclined without seeing the question. I don't know where it's coming from. I don't care where it's coming from. Why would be buprenorphine? It's a partial agonistic, right? Partial agonistic is one that doesn't fully occupy the receptors. It produces a biological response, but does not as a full agonistic in which methadone would be, right? Specifically, if someone is pregnant, so the answer most likely would be, guys, I don't know where this question comes from, and I'm not answering any question that I should not, right? But it should be buprenorphine. When would it be methadone? Let's say it's the same person that uses opioid every day. Now I want to select a medication that is a full agonistic. In that case, methadone could be the right answer. So how do you answer a question like that? What is the scenario? If the scenario says, is not a habitual user of opioids every once in a while, but, decided to go, 24 hours using it, now is in your clinic, you may want to do buprenorphine. If it's someone that uses every single day, you may want to start with methadone. Both answers are right. Okay. Now, in pregnancy, what we want to do is not let the mom go into a withdrawal because it would need to protect the fetus. So I don't know what is the question, and I don't know what is the answer. But if you understand what I'm saying, it doesn't even matter what the question says. Just read your question, and you will know what is the right answer. Does it make sense, Jeanette?
Yes, thank you so much.
So I created 3 questions in a crash course review, in which one, I can even pull it. I'm not going to try to pull it up because otherwise I'll be clicking on every question. There is over 2,000 questions there. One, the answer is methadone. Next to each other, so you can see the difference. 2, the answer is buprenorphine. And 3, the answer is do not give naltrexone. Right? Someone has an alcohol use disorder, decided to go use opioids, shows up in your office as a doctor, I don't want to drink anymore. I'm just tired of drinking. I need to change my life. I say, okay, tell me all about your drinking habits. Yeah, but yesterday I had opioids. I was in a party and I was bawling and I had a good time and asked for methadone. Asked for naltrexone. Should you prescribe naltrexone? No, because if you do, what's going to happen? You're going to put them in hardcore withdrawal. So I made it 3 questions so you can see the difference here. Okay. Alrighty. So thank you for the question. My pleasure, Jeanette. I know you should be testing soon, right?
Yes.
I know. I'm tracking you, Jeanette. I track everybody. Okay. In a good way, always. All right, Buloka.
Dr. Lopez, just
Sure.
a quick question. For the Kahoot questions, when are you gonna upload what is the link to get to it? And are you gonna upload for like the other modules? When do you plan to upload
So
those.
you have to go to the NP Exam Coach YouTube channel. I sent the link to the guys that do media and stuff. I never see them. So they upload it. They usually upload. Google takes about 48 hours to send it to me. So I just started seeing the crash course review come to my email today because it was 20 hours of a class in 2 days. That is crazy. So it just started receiving today. And then tomorrow I send to the guys that do media, and then they'll upload to our course. Now, the Kahoot, I can't upload to the course, otherwise it's going to make this course huge, right? So I only upload to the YouTube channel. Now, here's one thing, guys. There's so many things here that you guys are not exploring. So many folks ask to do one-on-one. You don't need a one-to-one. I gave it to you. Module 11, student meetings, 8 hours of one-to-ones. Oh, I can't come to the live class. Where do I find it? Module 12, the live class. Right? So it's right here in your course. I prefer that you do the small short videos because it's to the point. It addresses what you need to know, and you can go on with your life. But if you like the longer live classes, you're always located on your module 12. Okay. All right, Jeanette, just search for NP Exam Coach YouTube channel, and they should be there. Or you can go back to the Kahoot and search for Dr. Lopes, NP Exam Coach, and you can find the same one of today, and you should be able to play it. I left it open. From now on, I will leave all the games open for anybody else that wants to play.
Thank you so much, Dr. Lopes.
My pleasure. Thank you, Jeanette. Bukola, are you there? Your mic is off.
Hello.
Hi there.
Hi, Dr. Lopez.
Hi.
So I don't have a question. I just want to tell you I passed my exam today, like 2 hours ago.
Oh my God. I was gonna say you're close to passing, but I didn't know what's today. So congrats.
Yeah.
That is awesome.
Thank you so much. I really appreciate everything that you did, that you're doing.
Yeah.
All the materials really helped me a lot. Even though I was anxious in the beginning, but I was able to like regulate myself.
Good.
Yes. When I finished, I still have like almost 2 hours left.
What?
Yes.
Are you still taking the right task? You had 2 hours left?
Yes.
Oh my
I had
God.
an hour, 55 minutes left when I finished the test.
You know, this is not a joke, but it happened to somebody. She said, I passed. So, well, that is great. But then she took the Psych certification for RN, only to get the certificate later and be like, what? So make sure you guys are signing up to the wrong task. Bukola, I'm not saying that's you, but I'm just saying it happened once, okay? And then she was so sad. And then she's like, can I get back in the course? So I'm like, yeah, no problem. And then she passed it again. So she knew the content. Super happy, Bukola. Please send me an email. Kind of like point out, I made it a list of what is next, how to take your DA license, if you want to open a clinic, what are the steps and things like that. Nothing too intense, but thank you for being with us. You accomplished your goal. So now on to bigger and better things, okay? Yes, finding a job. Guys, here's what I would do. I honestly will do this. You only need one person to say yes. Doesn't matter if you have 50 no's. You just need to be like, okay, you don't want me? Fine. I would make a list for every psychological clinic in my city. I would literally make a list. I would dress up myself and I would go knock on every door. And I would say, I am a graduate. I would like to see patients on your clinic. Would you mind renting a room for me? So you have your patients that do psychological service. They don't have a provider. So you come to where the patients are located. And you're only going to pay a rent for one room. So that is a gold ticket. You know, if you say, can't find a job or it's been difficult, look around. Look around. This is what I would, and I got so many. My first 3 jobs was like that, right? Went to the clinic. Oh, you guys are open. Great. My name is Dr. Lopez. I graduated. I don't have a job. Can I rent a room here? That is it, right? You can find a job like that very easy, but you have to be able to receive negative feedback. Not everyone's going to take it. They may say, you know, you can work it out the conditions, right? Be able to take 10 no's and not give up. The secret for success is never giving up. You know, never giving up. Now, what else would I do? Look at the VA if they have internships, right? Look for companies that have internships because you are going to gain lots of knowledge. So your first job, if you can, you should not be worried about money, but you should be worried about quality of care. Because from there, you can get what you want. But if you don't have the knowledge, you can never get what you want. You're always going to be stuck at the middle ground, right? You have to set yourself up with knowledge first, and then you are able to demand, if you don't give me what I want, I'll leave. Simple as that, right? But that is 2 cents that I would say for those that are just passed now. Maybe you live in a small town, you know, start looking for those opportunities, okay? Congratulations, Bukola. I'm super happy to see that you passed. That is always awesome. Good, good, good. All right. Hiba.
Hi,
Hiba?
hi, Dr.
Hi.
Lopez. I did crash course number 4, but I only had like 11 questions.
Okay, great. So go back to it at the end, refresh the screen. It says take it again, and they should bring to the 65.
Okay, thank you so much.
All right, thank you. Because you were too fast. By the time you got to it, I only had 11 questions. Now there is 65. Then there is the 5, 6, and 7.
Yeah, I did the 5 today, and when
Good.
I did the 11 and then the 65 question on the crash course number 5.
Yeah.
Oh,
So,
if I'm scoring like in the 50s, is that good?
I mean, 50 out of 65.
65.
Yeah, it's good, but you really want to not only it's not the score that really matters.
The
If you
rationale,
notice,
yeah.
the rationale is intense because
Yeah.
you know 50 out of 65, so you're in the 76%, 79, 77, 76, and a little bit, right? So almost 77. So
Yeah.
the rationale is, if it's the answer is lithium, I'm not only talking about lithium, I'm talking about lithium and other things that go along with lithium. It goes a lot more than what the question's asking. So it's really covering a lot of the course in the rationales. Now, make sure that a week later you go back to it and get 65. Make sure that you didn't forget the content, right?
Yeah.
Because if you got it wrong, it could be that the question was complicated or could be a lack of knowledge. And you want to make sure you're closing in as much as possible so that way when you go test, you're doing well. Okay?
Yeah, thank you so much.
All right, my pleasure. Will, are you there? Wills?
I am here. Can you hear me?
Hi. Yes, I can. Hi.
Yes. So my question is, Dr. Lopez, it's about the online, because I know we're talking about the review for the crash course. So I also download the X app on my phone, so that way if I'm at work or somewhere I can still access it without even a computer. Where can I find that? Because when I go online, you'll be able to see the crash course review day 1, day 2, and then there's one that says that just a PMHNP crash course review. So where can I find those crash course questions on those X?
Oh, okay. The question, right? Have you done any question bank?
I'm done with question bank 1 and I've started 2. I'm only have like 50 questions left to go, and which I'm planning on
So,
complete tonight.
Will, what I'm talking about, are you doing the question bank after each module or no?
after each module. So I
Okay.
watch the videos and
Okay.
like the same way you ask us to do. Watch the
Okay.
videos,
And
mark
then do.
them, and then do question.
Okay, perfect. So watch the videos and do the question. So you're talking about this. I just want to make sure this is not the 600 questions that we sent out. So you did this one, module 2.
Yes, I'm on my module 2. I'm on the 50. I have 50
Perfect.
questions left.
Okay, perfect. Okay. All right. So the question bank is not going to be on the app.
Okay.
Okay, only the video. So that the question bank is a different system. So I pay for 2 systems, one for the videos, one for the question bank, because the video one doesn't have a good system for the question bank. That's why we have to log in on one system and log in on the other system.
Yes, yes, yes. That I know because once you're done, it also give you like an access if you wanna go to question bank.
Yes.
Yes, but my is the question you mentioned is it gonna be on the question bank, those module,
Or are you talking about the diagnostic
the
test?
diagnosis tech? I'm able to see like diagnose like test 1 and
Right.
test 2, but I'm talking about the crash course review, like those 65 questions you mentioned earlier.
No, it's on the question bank.
Oh, it's on the question bank.
It's on the question bank. Now remember, it can disappear, contract and disappear. So all these questions can go away and come back. So there is an arrow that expand and contracts.
Okay.
So here they're all gone, right? So you can just kind of like select whatever module you want to select, and then you can practice any question that you want to
Okay.
practice. So
Okay,
they're
and
right
it will
here.
be module 6 for them.
Yeah, so which is must complete crash course review. So these are all crash course review questions.
Okay.
Okay.
Okay, and then there will be like for the mod that will be like the crash course review 6 and 7, which
No, I mean, no. Good question. This is all crash course review. It might be a question here from day 2, might be one here from day 1. So now it's game on, right? Just like on the board, they will not give you. They might give a question on Eric's on the first one and the last one. So it's all mixed.
Okay.
No rhythm or pattern. I try never to put 2 questions on the same topic behind each other, unless if I want to drive a point, like the buprenorphine versus now methadone. I want to drive a point, so I did one question behind the other, so you guys can see the difference. You know.
Okay. Now I understand. But and my last question for tonight:
Mhm.
do you think like after I complete those module and then start watching the crash course review, let's say day 1, and after watching this day 1, I should come to the question bank, do the crash course review day 1?
Yeah,
Okay.
yeah, absolutely. But here's what I say: Will, do not watch the crash course review videos unless if you not planning to come to the live. You do not have 20 hours to watch the videos unless if you can't come to the live, right?
Okay.
So on the crash course review, come to the live. Do not waste time watching the video. Now, after the live, read many time your PDF. There is no need to watch the crash course review videos unless if you say, hey, I work that weekend, I can't come. Does that make sense?
Okay.
Because that becomes too much, right? You come to the crash course and then you do 20 hours of it. By all means, if you want to watch it, I'm not saying you shouldn't, but I just would not. Because if I come to the live and I have the document, why would I watch the same thing in videos? But not everyone can afford to come to the live. This is why we provide the videos for them so they can still benefit.
Okay.
Okay.
And also for the crash course review, do you think I should take it, let's say, right after I register for the crash course review or watch it? I should consider taking the exam like maybe that same week.
Yes, you know, the answer to that is how close you are on your diagnostic test. If you did well on your diagnostic test, then taking immediately after the crash course review live, it's a great plan. If you didn't, you may want to push it back a little bit. Specifically, the next one I think is May 16, 17, and June 13 and 14. Right, so we're not too far away. We're 2 weeks away from the next crash course review, almost.
Okay.
Okay.
All right. Thank you, Dr. Lopez.
My pleasure, Wills. All right, Michelle. Michelle. All right, so we'll do 3 more here. So,
Yes, Dr.
Beatrice.
Lopez.
Oh, yes. Hi. Go ahead.
Hi. So, I sent you another email because I'm locked out of the question bank. So, is it
Okay.
possible for you to look at the email? And
Yes,
then,
I'll
take it
I'll
from there?
definitely do that. Since the
Yeah.
question bank, I know you want to do some questions. I'll definitely do that
Sure,
immediately
sure.
after here.
And as I said, I'm willing to pay for whatever it is. So, yeah.
No worries. So we'll work it out. Okay, Michelle.
Okay. Thank you so much, Dr. Lopez. Have a good
All
night.
right. Good night.
Good night.
Beatrice.
Hi, Dr. Lopez.
Hello.
My question is, I know I had that those questions that you added on the crash
course
course,
review.
and then I think some of them on the supplemental. How do I go back to refresh? Because when I go back, I still see the ones I did.
Yeah. So at the end of it, Crystal Law just passed as I open my email. 3 other students just passed, so that is a great thing. So I see you. So the answer is, it says retake it. You just passed.
Okay, I just click retake it.
That's it.
Okay. I just
Okay, just says to retake it.
Okay, thank you.
Yeah, my pleasure. So last person, because I really have to get going. Otherwise, my wife will be super mad at me. Louise.
Hello, Dr. Lopez. Sorry.
Hi. No worries. How can I help you?
Okay, so I'm due this test on June 17, and I'm literally just almost finishing module 1. Am I on the right track?
You are on the right track. You are in the, hold on.
I feel like I'm falling behind.
I think you are in a good pace because we're on the 30th, so that means you would finish at least 4 more modules by the end of May and attend the crash course review. You are perfectly setting just after the next crash course review. That means you attend 2 crash course reviews. I think you're in the perfect spot. Now it's still a lot of work, right? It's not easy. I know some people do it in 3 weeks. I don't know. They don't have life. I guess they don't have to work or something. But you gotta keep going. So your goal is to watch all the videos from module 1 and complete question bank 1 this week. That is your goal. Next week is complete module 2 videos and then complete module 2. Now the secret here is very important for you. Each module has a PDF. As you keep advancing to the next module, you can't forget the information that you learn here, right? Just by saying, okay, done. It doesn't mean you really keeping information. So while you have the information, make a habit to always go back on your PDF and active recall. What is the active recall? Is now reading the PDF. Let's say the topic is lithium. Don't read this information. Just say, hey, what do I remember about lithium? You're not going to remember everything, but you're forcing your brain to connect the dots. You're forcing the brains to, maybe you're like, I just don't remember about this. Then you just go ahead and read it. Active recall, you can do a whole module in less than an hour. I can do a whole module in 20 minutes. Just by looking at the title, say a few things that I remember, moving on. It's very important. This is so important to active recall. And then you arrive to the crash course review. You have opportunity to attend 2 of them. On the last one, towards June 10th, start
13, 14.
Yeah. So about June 10th, you start like doing your diagnostic test, and you should be just in a good spot by June.
Okay, thank you so much, Dr. Lopez. I was kind of worried.
No.
Okay, a little bit worried. Okay.
And never be worried. If you have any question, you can always email me at pmhnp@npexamcoach.com. I can look at, I can help you out and give you some strategies or say, hey, this is what you should be looking at it. And you'll be okay, I promise you. In the beginning, it's a little bit hectic finding out the rhythm. But once you get through the first one, you'll be like, oh, it's not that bad.
Okay. Thank you so much. I'll definitely send out an email. Thank you so much. Appreciate your time.
My pleasure. You guys have a good night. Thank you for being here with me today. Next week, we'll be covering module 2. It is the most important module. Why? It's not because I like the most, it's because most questions will come from there. So make sure that you fully understand that you get all those questions. I'll see you guys next week, next Tuesday on the live. Have a good one, everyone. Thank you. Bye-bye, everyone.